To your health tonight, doctors are reporting huge success with a fairly new drug used to treat people with advanced melanoma. And while experts stop short of saying the word cure, the drug is giving many patients hope to live longer than they would have just a few years ago. Erica Edwards reports.
South Carolina, yes.
Former President Jimmy Carter was in good spirits during Sunday school this past weekend, cracking jokes,
Even some of my own family.
even telling the audience he'd been well enough to travel to Europe the previous week. Remember, Carter was diagnosed with advanced melanoma in 2015. His continued vitality is not typical of what doctors have historically seen with such patients. Their average survival only about 11 months.
We've made a huge impact in this disease that had very little hope before.
Carter had surgery and radiation, but also received a drug called Keytruda. A new study finds 40% of patients with advanced melanoma were alive 3 years after treatment with Keytruda.
We have an opportunity to give people with advanced melanoma the chance to live longer, and maybe for some people to make their melanoma go away forever. This is huge in the melanoma field.
Cancer cells have the ability to hide from the immune system. Keytruda works by disrupting that cloaking effect, allowing the immune cells to find the tumor cells and destroy them.
There's a certain group of patients whose tumors will shrink. There's a certain percentage of patients who it will stop the tumors from getting any bigger, and they stay that way for months to years.
Doctors are not calling Keytruda a cure, and it doesn't work for everyone. But the hope is that more and more patients will be able to look at cancer more like a chronic disease than a killer. Erica Edwards, NBC News.